Good morning. Welcome to Access Health. I'm Ereka Vetrini. Summer is officially here. Time to get some sun and show some skin, right? Not so fast. The latest statistics from the American Academy of Dermatology show skin cancer continues to be by far the most common type of cancer in the U.S. The good news is it's highly treatable if it's caught early. But experts say our goal should be prevention. So this summer, remember your sun protection arsenal. A wide-brimmed hat and sunglasses with UV protection are a must. Dermatologists also recommend you use broad-spectrum sunscreen with an SPF of at least 15 or higher. We'll have more summer skincare tips later in the show. Access Health starts now. Our skin is by far our biggest organ and arguably our most important. After all, our skin is our first line of defense against infection. So anytime you get a wound, it's serious business, especially if you're one of the millions of people dealing with serious wounds. If that's you, listen up because your wound care routine just got a lot less traumatic.
Oh, I love the blues. I kind of grew up around the blues. I live it. I love listening to it. I love playing it. I went to high school in New Orleans, went to Berklee College of Music in Boston, graduated with a degree in instrumental performance. I was a professional musician, played all over the United States, and I'd like to get back to that. I've also been in the construction trades and built some pretty major projects all over the United States. Well, I used to be in great health, but in the year 2000, I came down with pancreatitis and it really screwed me up bad. My diabetes went out of control pretty bad and gained a lot of weight, had a lot of medical problems. In 2009, I had a pretty horrific diabetic wound on my right foot and I became permanently disabled. I have not worked since 2009 and I've been fighting a multitude of wounds on my feet and my legs and wounds from various falls and slips from being handicapped. I just want to go back to being a regular person.
Everyone has the occasional minor bump or bruise that we slap a bandage on. But if you underwent surgery or you had an accidental burn injury or you have a specific wound-related medical issue like Terry, then you've had to deal with advanced wound care. Turns out that a lot of people, an estimated 17 million of us, will struggle with the difficulties of wound care this year. So joining us to talk more about wound care is Terry Young, along with registered nurse and board-certified wound care specialist, Weir. Thank you so much for joining us. We have a lot of important things to talk about today. So Terry, I'd love to start with you. Tell us a little bit about the struggles that you deal with when it comes to wound care.
First and foremost, there's a whole lot of pain and physical and psychological trauma associated with all that. Your whole life changes because you become a professional patient. You can't work anymore, you're at home, you're not making any money. All phases of your life change in the most profound way.
I want to thank you, first of all, for coming and sharing, because I think that's very important for everybody out there. So thank you so much, Terry. So Dot, I know that you've been working as a wound care specialist for now almost 40 years. You work on the team that helps take care of Terry. In your opinion, what are some of the challenges that you see with wound care on the medical side?
Well, the medical side brings all kinds of challenges. First and foremost, we're dealing with a disease state that has caused a change in somebody's skin, or they have developed a wound or had a trauma that now their disease state takes over their ability to heal normally. All of us are used to healing thoughtlessly, that we don't have to put any effort into it. But folks like Terry, when they have diabetes and other disease states, there's many reasons that people have wounds, are challenged with healing. And so they have this necessity to have dressing changes done on a daily basis and create an environment for healing that we have to emphasize to them is necessary.
And I know, Terry, you've talked a little bit to me personally about how you can make advancements and you feel like you're healing, and then so simply you can take one step forward and then 2 steps back.
With most normal people, it just takes a few days for a wound to heal. It might take me weeks or months. In some cases on my feet, it's taken years. So any setback is horrendous, and any advancement with different kinds of medications or treatments or bandages helps so much for somebody like me. I mean, you don't know it until you've lived it.
Truly, it's been an emotional and psychological struggle for you until you came across this product. It's called Safecac, right, Doc? Can you tell me exactly what is Safecac?
Safecac is a technology that is our first introduction into reduced pain and trauma with wound healing and with dressing changes. Something we had thought about before, but they really brought it to the forefront of people who do wound care like I do, to have us start thinking about how much we're hurting these people when we change their dressings. So it's everyone has had something adhesive on their skin, and we know that when it pulls up, it pulls hair, it's pulling on skin cells. So doing that repeatedly, like with someone like Terry who has to do frequent dressing changes, you know, 1 or 2 or 3 times a week, you're going to strip the skin and cause injury. So with this, it's adhering with silicone, and the silicone sort of goes down in and amongst the skin cells so that when you take it off, you're not stripping anything. The silicone does not adhere to moisture, so it doesn't pull off the healthy tissues that are trying to grow in the wound. And then it also creates a moist environment by absorbing the exudate, but protecting the peri-wound skin. So it's not pooling drainage, or we call it exudate, but drainage on the skin, which will further damage the surrounding skin. It causes a situation called maceration, which is just over-wetting of the skin, but it can destroy good, healthy skin, so it's something that helps us to prevent that as well. Something I've always felt about wound care is we only have one opportunity to hurt somebody. If it hurts when we do it, they're not going to trust us, they're not going to want to come back. And so if we can use something that will reduce that pain at dressing changes, it won't be something that they dread.
So is this something that only you have access to at the hospital?
No, actually that's the beauty of it. It is now a product that is available to the general public. It's the first time this advanced type of dressing is available at retail pharmacies so that patients can have access to it certainly with the guidance of their healthcare professional, but have access to at their local drugstore.
With this sort of a product, is it helpful with the pain relief? Does it require less pain medication potentially if you're relieving the pain?
Well, there's absolutely a lot less pain by using this product. I take it off, I clean up the wound, I put it back on, and life goes on.
And so as a result of less pain with dressing changes, there was a study done that actually looked at the fact that over 70% of the folks that were using this technology took less pain medication. And pain medication, while it is a necessary evil, it affects your whole life. Your ability to drive, work, you're sleepy all the time, your appetite is less. So the ripple effect of pain definitely negatively impacts wound healing.
So how has it improved for you now that you have Safecac?
Well, it makes my daily care so much easier. It's to the point where I can clean it up at home, put something clean and sterile on, and I know I'm not damaging something that I've spent a lot of money trying to get to heal, that I don't go back to square one all over again. Makes me much more confident to take care of a problem at home on a daily basis.
Thank you so much, Terry, for joining us, and Dot, thank you for all the great information. Where can we learn more about Safecac?
Well, you can go to safecacathome.com, and that's Safecac, TAC, at home.com.
Thank you so much. Again, you can go to safecacathome.com to find more information about their technology, or just log on to accesshealth.tv. When we come back, a hip replacement surgery technique that's helping patients get the skip back in their step much sooner. More and more people of all ages are turning to biking, walking, running, and working out at the gym in an effort to live healthier, longer lives. As a result, we now have this middle-aged population with a lot of wear and tear on their bodies who are now finding it necessary to have joint replacement surgeries earlier in life. Access Health caught up with hip and knee specialist Dr. Jimmy Chow to learn about one of the latest surgical approaches helping to put the skip back in our step.
My name's Chris Appleton. I'm 42 years old, and my hip actually started hurting about 2.5 years ago. Went to college at Pittsburgh State, played college football, won a national championship, probably part of the reason why I needed new hips.
My name is Carol Alice. I'm 56 years old. Probably about 6 years ago, I noticed just a decrease in mobility. 2 years ago, it just progressively got worse. My walking was diminishing, my ability to get up and down off the floor, and then traveling for work really became more complicated.
We know that over the past decade, the need for joint replacement in the United States has more than doubled. And so we're treating younger patients earlier with arthritis in their hips so that they don't have to live the rest of their life with arthritis in their hips until they get, quote, old enough.
A lot of pain, discomfort, difficulty sleeping, could not stand for long periods of time, couldn't sit for long periods of time, couldn't walk. It was very uncomfortable, very debilitating.
Everyday things that I took for granted, people take for granted. Tying your shoes, putting on your socks, clipping your toenails, bending down and having to go to the bottom shelf at the grocery store, getting in and out of cars, climbing 2 steps. Even getting off a plane for me was one of the most horrible feelings in the world, because typically you get off a plane, and I fly an awful lot every week, and you get off the plane and you have to go up the up ramp, and it was the hardest thing for me to do was to go up that up ramp. It would take me holding onto the railing and pulling myself up.
If you think about what pain is, a subjective form of pain measurement is probably the most accurate, because it's really how you feel that matters. You have patients where the arthritis is so horrible, it's kind of like chewing on a very bad cavity for a long period of time.
You think it's your sciatic nerve, you're getting older. It's that curve of 45 to 50 that we all get.
Originally diagnosed as lack of flexibility in my hip, and then it was diagnosed as a sciatic nerve problem.
You know, I tried the chiropractor, I tried physical therapy, I tried injections. They were all very short-lived. Oftentimes physical therapy, swimming, created more pain at the end of the day than it did actually relieving it. My primary care doctor did the x-ray, noticed that the x-ray had some deformity, and he referred me to Dr. Chow. And then Dr. Chow diagnosed that I needed a new hip.
So I had 0% cartilage in my left hip and 25 to 30% cartilage in my right hip. And my specialist recommended that at that point I start looking at surgical options. I definitely wanted to seek the best surgeon and try to understand the various procedures that are out there.
The first time that a patient gets offered a hip replacement, their answer is often, no, I'm not ready for that. It's kind of a hard pill to swallow. It is considered major orthopedic surgery. But once you get over that initial shock, and you start talking to other surgeons, and you're starting to get a consensus about what's going on around your hip, then it's much easier to digest in terms of that.
Most of the surgical approaches in hip replacement are options that involve some kind of trauma to the surrounding muscles and tissues. This can lead to long recovery periods as well as missed time at work.
I'm only in my mid-50s and still wanted to travel and do everything I had been doing. And so that's when I made my final decision to use Dr. Chow's new procedure.
Now, hip replacement surgery historically removes the ball of the hip. That's why it's called hip replacement. So the ball of the hip is what's diseased, and it becomes kind of flattened or misshapen, and it kind of grinds on the hip. And so we replace that ball, and we put a liner in the socket to protect the pelvis. One of the earliest ways to do hip surgery were all based on keeping the hip in kind of a straight position. And by flexing the hip into more of a fetal position, all of your muscles become relaxed. The main structures we cut are going to be skin, then fat. Our average was 6 and 8 centimeters. And then we split the muscle without cutting the muscle. So I actually use my finger to split it. We're actually using the normal spaces between muscles. And so we're actually placing retractors into positions in between the muscles. We expose the envelope of the hip. We make an inline incision, which is just a straight line, and open it up like that. And then that capsule becomes a reverse tent for our entire procedure. We're not ripping anything around. We're not putting stress on the hip that we can avoid. We're really trying to be very gentle with everything. SuperPath is a convertible surgery. It's a surgery that starts off as SuperPath, but you can easily convert it to the workhorse incision that you're used to. And worst case scenario, you don't get SuperPath, you get a traditional hip replacement. Contrary to traditional surgery where you cut everything and then you know, oh, it's going to take you about 3 months or 2 months to heal that part of it. We're not doing that. So what I tell my patients, and this is what I see as an average in my office, most of our patients are up and walking within hours of the surgery. But the nice thing about this is that it puts the healing process back into the hands of the patient, because they're no longer sitting in bed with a bell in their hand. And then in order to get them to heal enough that they can go and, say, put on their own clothes or shower themselves or make themselves a sandwich, they should be able to do that pretty much right away after the surgery.
I went into surgery December 10th of 2014. Within 3 hours of being in my room, I was up and walking on my new hip. I literally woke up, And they got me up and I was walking down the hall, and I was home the next day, and I was back to work in 13 days.
The day after surgery, I walked a mile on both hips. So after both surgeries, the day after, and it's encouraged that you'd get that activity going as soon as possible. And I was able to walk up and down steps the day after surgery.
What we've discovered is that most of the problems that patients experience after a SuperPath hip replacement don't necessarily come from the surgery. They actually come from the immediate change in their activity level. So they go from basically not doing much to all of a sudden being able to do quite a bit, and they can move quite a bit better too. So we know that the hip replacement is going to work fine, but now what we want to do is we want to prepare that patient for their new onset activity level. And that's what almost all of the physical therapy is based on. It's quite exciting.
I have done workouts. I have done some light jogging, fast walking in the last 9 months. And I've done a lot of swimming this summer, and absolutely pain-free.
It's been a godsend for me. The surgery enabled me to get back to a lifestyle that someone at 42 years old that really is healthy everywhere else should lead.
Walker.
It's pretty awesome. Nicely done.
You man. You man.
Coming up after the break, one of the most common ailments in America is also potentially one of the most dangerous. We're talking about asthma, up next on Access Health. It's one of the most common and costliest diseases, and if you're one of the estimated 26 million people with asthma, you probably already know there is no cure. But you can manage this chronic disease. Michele Cassalia of the Asthma and Allergy Foundation of America is here with some answers. Welcome back, Michele. Always so good to have you here.
It's awesome to be here. Thank you.
So last time you were here, we talked about triggers. Now let's talk about symptoms. How do you know you have asthma?
Asthma is when your body's airways become inflamed. It makes it hard to breathe. Some of the signs and symptoms may be coughing, wheezing, a tightness in the chest.
Okay. So then how do you get diagnosed?
You want to go to your family doctor or your local allergist, and he'll do a family medical history. He'll do a full physical exam. He may take a lung function test.
Okay.
He may also do an x-ray of your sinuses and also your lungs.
So let's say you're diagnosed. Now, how do you manage that diagnosis?
Well, you want to make sure you know your triggers.
Okay.
You want to make sure you take the medication exactly how the doctor prescribed it. You want to be able to track your asthma so you know if it's getting worse.
That's smart. So I'm assuming an action plan is in order.
An asthma action plan is your best bet.
Okay.
You want to write down that asthma action plan. You want to share it with your friends and your families, and if you have children at school, you want to share it with the teachers and the school personnel. It's a great idea.
And I'm sure there's more information on your website.
The Asthma Allergy Foundation of America website has a complete asthma action plan form that you can use and take with you and print out.
So it's not the end of the world.
It's not. Asthma is a chronic illness, but it can be managed and you can live your life without limits.
Fantastic. Thank you, Michele. And that website is aafa.org. And of course, you can always go to our website, accesshealth.tv. Michele, we always love having you, full of such great information.
Thank you so much. Thanks for having me.
No problem. Dermatologists at Mount Sinai Medical Center were recently asked to share some of their summertime skincare tips, and this is what they had to say. First, apply sunscreen 30 minutes before going out into the sun so it can bind to your skin and offer maximum protection. And be sure to reapply every 2 hours or immediately after sweating or swimming. Second, get some sunscreen milk. What is sunscreen milk? Well, it's a sunscreen with a thinner, milkier consistency that soaks into the skin more like body lotion. The benefit? It can't rub off onto your clothes and it stays right where you want it to. And if, despite all of that, the worst should happen and you do get a sunburn, try soaking a face cloth in a bowl of skim milk and ice. Then apply it for 5 to 10 minutes to help with the redness and inflammation. And don't forget your ibuprofen and some hydrocortisone cream for pain relief. That's Access Health for today. Love the skin you're in. See you next time.